The Food Mentoring Toolkit is designed to build capacity within agencies to deliver consistent nutrition information and food programming that support key messages from registered dietitians. This video is part of a series of videos and supporting resources. For a list of all the resources available, see the Food Mentoring Toolkit section of the Saskatchewan Health Authority website. If you are interested in providing this nutrition information session for your clients or staff, facilitator guides are available for each topic to provide important background information and support. Please email your public health nutritionist at publichealthnutrition@saskhealthauthority.ca to access your free facilitator guides. Welcome to the Food Mentoring Toolkit video, Finding Nutrition Information You Can Trust. In this presentation, you will learn about how to evaluate nutrition information, how to identify reliable sources of information, how to identify and limit the spread of misinformation, and what some credible websites are that you can look to. You can use what you learn in this presentation to equip yourself and your clients to find evidence-based nutrition sources and information. With an endless amount of nutrition advice and conflicting messages available, knowing who and what to believe can be challenging. Have you ever tried to search for nutrition information on the internet? You will get all sorts of advice. It is important to recognize that much of the nutrition information available online can be biased, misleading, lacking evidence, or simply just incorrect. The fact that information is widely shared or repeated does not guarantee it is based on accurate facts. The science of food and nutrition evolves with time, making it hard to keep up to date with new findings. Along with changing science, the internet and social media is overflowing with individuals claiming that they are sharing the latest and best nutrition advice. Wrong conclusions can be taken from poor quality research studies and then passed along as being supported by science. Recommendations can also be based on personal beliefs or experiences rather than proven facts. Sharing of misinformation can cause mistrust, mental and financial strain, and can be harmful to health. When looking for or sharing nutrition information, consider the next few questions to determine if the information should be trusted or not. First, who wrote the information? Look for the author's credentials. Not all information is written by qualified medical, scientific, or credible health professionals. There are many unqualified health professionals making false claims on the internet. Ensure a credible nutrition expert is providing the advice. The most credible nutrition experts are registered dietitians and individuals with a master's or PhD in nutrition science. Registered dietitians are provincially regulated professionals who have specific training and a university degree in food and nutrition. The title of dietitian is protected by law, just like a nurse, pharmacist, or doctor. Public health nutritionists are also usually registered dietitians, but always look for the initials RD or PDT to identify them. You can also check out a website's About Us section to learn more about the people or company responsible for the information. Second, is the information based on personal stories or testimonials, or on proven facts? Have you ever received nutrition advice from family or friends? Were you able to tell if it was credible information or not? What could you ask or do to find out? It is nice to hear success stories, but it is not proof that something works for everyone, or that it is true. Success stories may intentionally try to appeal to their readers' emotions and can be misleading, as they are often based on opinion or personal experience instead of evidence, so may not be reliable. Nutrition advice should be based on the best available scientific research. Scientists who specialize in nutrition research and registered dietitians have the knowledge and skills to determine if nutrition information and advice has solid evidence to support it. You can also look into whether the advice is based on a single study or a few research studies. And did the studies involve humans or animals? The quality of the study matters, with human randomized control trials being the gold standard. In these types of studies, similar people are randomly assigned to groups to measure how effective a treatment or intervention is. The more people included in the study, and the longer the study time, the stronger the results will be. Advice based on one single study, even if it is a high-quality randomized control trial study, is not enough evidence that something is fact. To determine if advice is supported by science, research and health professionals look for evidence-based or multiple similar studies related to a specific question or theory, called systematic reviews. The more high-quality studies that show the same results, the stronger the evidence is that something is true. Next, is there a promise for a quick or easy fix to a problem, like fast weight loss or a miracle cure? Think about the latest miracle cure you've seen on social media. Be careful of health information or articles that claim a pill or food will cure illnesses or produce immediate results. If the information sounds too good to be true, it probably is. Look for reliable websites. Making changes to your health usually means a long-term commitment to eating well, being active, and adopting healthy lifestyle habits. A trusted healthcare professional should be consulted before making significant food or lifestyle changes to reduce the risk of negative impacts to health. Does the advice include buying special products or replacing foods with supplements? Be wary of websites advertising or selling products that claim to improve health, such as special foods, supplements, protein powders, diet pills, and diet books. Many of these companies use false scientific claims, called disinformation, to promote their products. Some products, supplements, and diets can be dangerous, have unwanted side effects, or interact with prescription medications. Speak with a dietitian, pharmacist, or doctor to learn more. Food is the best source of nutrients. Special products and supplements are usually not needed to improve health. Does the information focus on or avoid certain nutrients or foods? For example, only eat protein. Do not eat carbohydrates. Avoid dairy. Think critically about websites or posts that vilify food groups and encourage you to avoid main food categories such as grain or carbohydrates, or only focus on eating specific foods, such as protein, for health. We need a variety of foods to meet our nutritional needs. No one food has all the nutrients needed. Avoiding certain food categories can increase risk of nutritional deficiencies. Be aware that dieting, severely restricting calories, skipping meals, or excluding whole food groups sets the stage for a negative relationship with food, which is contrary to promoting overall health. Always check when the information was written and whether it is reliable. Look on the web page for the date it was written, reviewed, or updated, often found at the bottom of the page. Reliable websites will include the most current, evidence-based nutrition information. Health information should be based on scientific evidence. The author should provide links to the evidence and references. If there are no references, or you are uncertain where the information comes from, it may not be accurate. Check the fine print. Sometimes at the bottom of websites, or if you click on a disclaimer link, there will be information indicating that the contents of the website are based upon the opinion of a person or state that the products are not approved by government standards. Registered dietitians, government authorities such as Health Canada, national health professional associations like the Canadian Pediatric Society, or national nonprofits such as the Heart and Stroke Foundation or Canadian Cancer Society are sources of reliable information. In order to help limit the spread of misinformation, where possible, discourage the promotion of trends or sharing of non-evidence-based nutrition information within your programming. Only share information from credible health professionals. See page 3 of this chapter and the website links coming up next for examples. This helps to build client trust in your organization. Avoid liking or sharing social media posts if you are unsure of their accuracy and credibility. On social media, follow professional and credible organizations and share their posts with your followers. Provide food literacy programming using the Food Mentoring Toolkit to build skills and resiliency. Consult a registered dietitian or public health nutritionist in your area if you require additional resources on nutrition-related topics. Here are some examples of websites with reliable information. On the general topic of nutrition, you can look to Dietitians of Canada's unlockfood.ca or Cookspiration and Government of Canada's Food and Nutrition page. For specific conditions, here are some good ones: Arthritis Society Canada, Canadian Cancer Society, Canadian Pediatric Society Caring for Kids, Canadian Society of Intestinal Research, Celiac Association of Canada, Diabetes Canada, Bridgepoint Centre for Eating Disorder Recovery, Food Allergy Canada, Heart and Stroke Foundation of Canada, Hypertension Canada, Lung SASC, and Osteoporosis Canada. To help avoid misinformation, use this checklist whenever you're not sure about the nutrition-related information you find. A printable version can be found in the Finding Credible Nutrition Information section on the Food Mentoring Toolkit homepage. Following the tips in this presentation summarized in this checklist will help to ensure you're using reliable and trustworthy information. This ends the Finding Nutrition Information You Can Trust video. You can refer back to the Saskatchewan Health Authority Food Mentoring Toolkit homepage for additional resources on this topic and to support learning on other important nutrition-related topics. Please let us know what you think by completing the short survey using this QR code or the link in the video description. We hope you found this information helpful, and we thank you for listening.